Hello everyone. With this diagram, we'll try to learn different types of bladder, that is atonic bladder and automatic bladder, for which we have to understand the innervation. So this is the afferent which are going to the spinal cord, where they end in micturition centers, that is sacral micturition center. From there, efferents they arise, they are going to innervate the bladder and the sphincter, and this is the higher voluntary control over the sacral center. In case of atonic bladder, it is there is involvement of the sensory nerves, which causes loss of micturition reflex, because of which the bladder is going to distend, become thin, and there can be overflow, incontinence can occur. So this occurs because of the involvement of the sacral segments, and also it can occur because of the diseases like syphilis, which affects mainly the dorsal root ganglia, and such type of bladder is called as diabetic bladder. Another type of bladder is automatic bladder, where it occurs because of the uh, the spinal cord injury above the sacral segments. So after the injury, after the shock is over, the sacral segment they are going to take over the micturition reflex, which becomes hyperreflexic because of the inhibitory control from the higher centers they are lost, and the bladder becomes spastic, and the micturition reflex occurs frequently compared to the normal, because even small filling can initiate the micturition reflex. And of course there will be loss of voluntary control over the micturition in automatic bladder.